Awesome. Well, thank you, Kent, and thank Oregon State Business Alliance for having us here today, and thank all of you for showing up, being here. Clackamas County is building a system of care, a recovery-oriented system of care that is really changing the face of delivering services and helping individuals on a pathway of recovery. And here to talk about that first, before we get into the specifics of the caring place, is County Commissioner Ben West. Ben?
Thank you for having me today. I want to give a quick special shout out, not just to my colleagues who are already recognized, but to our service providers that are quite spectacular, and we are lucky to have them in our county. I know that they're some of the crown jewel of what makes this work possible in the entire region. We have Brandy here with LoveOne and Father's Heart and her entire team. If you're part of the LoveOne team, just wave at us really quick. We appreciate you. Thank you. Dan, right, you're the chair of the board. Thank you for your work as somebody in the business community and also helping us deal with this persistent crisis that we all face. We appreciate all of you. Thank you. So my name's Ben West. I'm a Clackamas County Commissioner. I also work as a cardiology nurse at OHSU. And to be honest, I ran as a county commissioner because I was I wanted to dive in head first in tackling the issue of homelessness, the housing crisis, and substance abuse disorder that we've all seen in our communities that's been all too persistent. And when I came on board, my perception is that the county was really upset. We were really mad that we were seeing going on in the metro area what we were seeing with our own eyes, the human despair at a rampant level. But we didn't have a lot of systems already established before the passing of the SHS tax. We kind of started from ground zero, and we got to build something that was the Clackamas County way, and we did that. When I came on board, I helped promote and push forward what's called a recovery-oriented system of care. It is a little bit different than what you may see in other counties, but it has been key to our success. And you may say, hey, Commissioner, what's a recovery-oriented system of care? It's a coordinated network. Let me go. That's me. Blah, blah. There we go. A recovery-oriented system of care is a network of community-based services that is person-centered and builds on the strengths, resiliencies of individuals, families, communities to achieve abstinence and improved health, wellness, and a quality of life for those with are at risk of alcohol and drug problems. We also call it, just for short, an ROSC, a recovery-oriented system of care, supports the premise that there are many pathways to recovery. And this is actually a bold statement, believe it or not, in Oregon. We believe that recovery is possible in Clackamas County, and that's part of our ethos. We don't believe in helping people persist in this disorder, but we believe that holistic recovery is possible in our county, and that's our goal. So early on, you guys might remember Project Turnkey. It didn't happen here. We don't have to revisit that. But immediately we said, we got to tell the community who we are, what we're doing, and why we're doing it, and what's the system we're going to operate in. And so that's where we passed a resolution. It's on our website. Please read it. It's worth a read. It tells you why we're doing what we're doing, how we're doing it, and what's the philosophy behind the recovery-oriented system of care, and how we're going to tackle this problem head on. So that's just a little picture snapshot of that. But it's a 2-page read. It's more than just a government resolution, which are a dime a dozen, right? But this specifically has informed who we are and how we're tackling this issue. Addiction, mental health, and homelessness are complex and often interconnected. We will admit that substance abuse disorder and untreated behavioral health contributes to the homelessness crisis. In April of 2023, we looked at this and took a bold approach. We did it the Clackamas County way, different than other counties, and we established the recovery-oriented system of care. After that, we said, well, you know what? Oregon's not doing so great. And the numbers were true. The evidence was out there that the problem continued to persist. It was acute, it was also chronic, and it was exasperating, and we weren't getting ahead of it. Something we'd never seen in Oregon's history was exploding, and we had to do it differently in Clackamas. So I helped form a recovery summit. We looked at centers of excellence across North America, and we said, you know what, where are they doing it differently than Oregon, and how can we replicate that model here in Clackamas County? And so what we did, we went out and built relationships from thought leaders and out of Alberta, Canada, some unique leaders out of California, Texas, Philadelphia, and we pulled these leaders, we brought them in, we had a summit with local leaders, local electeds, and we said, you know what do we want to do here? We have to build something. Vahid will tell you we didn't have much of a system before we had these resources, but now we've started to build that out. And this summit really helped us kind of chart that pathway after we did the resolution. And it was to take an evidence-based approach, look at best practices, figure out what's working to expand services and invest in the needs of people around substance abuse disorder and behavioral health needs. And we found those solutions and started to act immediately. And we were okay being different than the rest of the state. We wanted to do what works. Okay. This all started with a brain dump of mine on a whiteboard in my office. Dan, you saw me go through this. This is a little neater than what I did with a bunch of dry erase pens. In nursing school, we used to do what's called pathomaps. We would look at a problem in someone's body, and we'd look at a holistic approach, and then we just map it all out, and what the interventions were, what the outcomes we wanted, how we would assess it, what was the disease process. And so for me, this is no different as a nurse. We have to look through, I look through that lens as a nurse. How could I help solve this problem? The patient is now my community. And so we wanted to take a holistic approach, which really falls in line with a recovery-oriented system of care. Where are we going to find the gaps where services aren't being met? And how are we uniquely going to tailor those interventions to the community that we're serving? So we started with a very robust approach. Vahid will tell you, we have some of the most robust initial targeted relationship building with those that are struggling with this in the entire state. Clackamas County, for its CHAW system, which you probably have heard about, actually was the only county in Oregon to win a national award by the National Association of Counties because of our innovative approach. We don't let people just persist in this state. We don't just give them a sandwich and a tarp. But what we do is we are following up them. We have a system and we know who you are. You're in our database. We know why you're homeless. We know you by name, and we're not going to leave you alone. It reminds me a little bit of my mother when I would try to leave the house without making my bed. She would not leave me alone until that bed was made, and pretty soon I was just making my bed every morning. We take that same type of approach with those that are struggling, and CHA allows us to do this. So we have robust outreach, trying to prevent the situation and also trying to be engaging with those that are struggling. It's self-directed. We want to make sure that we're partnering, coming along those that are struggling so that they can also make the cognitive decision for change in their own lives so they can get on a pathway to recovery. We don't do enough of this in the state. We don't realize that there's a bridge here of stabilization. I can often tell you what someone's apartment's going to look like in permanent supportive housing by looking at their tent. They're not always ready for that step. And all too often we skip the care continuum in between the beginning of the care need to the end of the care need. And so this could be detox, this could be medical stabilization, this could be intensive therapy. There's different things that we need to do to stabilize an individual so they can get cognizant of their own need for change. We do pre-treatment care, stabilized housing. We just opened the Clackamas County Village. That allows us to provide more of that acute stabilized care before someone moves on to permanent supportive housing. We build an entire recovery community that's peer supported, that's holistic in its approach, that wraps around the individual. And then at the end of the day, we want to stabilize people to the maximum capacity of that they can be stabilized. And so that may be for an individual that was 18 months prior, street-level homelessness in acute state. But in our system, our goal is, are you now engaging the workforce? Are you working to get your education at Clackamas Community College? Are we working to help you get your GED? Are you building that individual capital back in your life that allows you to be successful in community, to be self-sufficient? And then those that need more supports, we may have to continually provide that. But as much as possible, we want people to have the pride and the dignity to have overcome this challenge in their life. And that's why we also say recovery is possible in Clackamas County. Okay, we've done a lot in just a few years, and it's been a whirlwind. You guys may have heard of the Recovery Campus. We haven't broke ground on this yet, but it's a multi-acreage campus that allows somebody maybe from street-level homelessness to the end of that care continuum to get the care they need. It's inspired by New Haven for Hope out of San Antonio that has been wildly successful. Commissioner Schrader and I had the opportunity to do a site visit there, and it was quite inspiring. And we wanted to do something a little bit bigger than maybe a hotel conversion or something that maybe nibbled around the edges. We wanted the assets necessary to get people the holistic care through a whole care continuum that they need. This campus is 7 acres. It will have long-term treatment, medical stabilization, detox facilities, workforce training. We might even have pet services so that they can have the ability to have their furry loved one with them while they go through recovery. Trauma-informed and evidence-based. We're quite proud of this. We are more than shovel-ready at this point. We have raised more than $22 million for the campus, which is the hub of our system, and we are optimistic that we'll get additional funding through the state. So if you know a state legislator, please call them and have them advocate for our additional $20 million as we are ending the session. The Crisis Stabilization Center is a 23-hour stabilization, but housing respite is attached to that. That's part of our system that we built in just a couple years. The Lake Road Center, it's a massive building, the largest mental health outpatient facility, I believe, in the region. Is that correct, Vahid? It has to be one of the largest. It's enormous. So we are excited by that, providing more people more access to care. The Clackamas Village, we just did a ribbon cutting with the governor on that. It's right next and modeled after the Vets Village, which Commissioner Savas and Commissioner Schrader were very instrumental in making sure happened. Are you guys here? Yeah, they're right in front of me. Yeah, Commissioner Savas, yeah. But we were able to do 2.0 because of the work they did years ago working with the veterans population. And so we're very proud of that work. And then we have recovery housing. We're going to have a number of we have some aging housing units in our housing stocks as the oldest housing authority in the state. And we're going to turn a lot of those into recovery housing and figure out how to implement that within our system of care. Also part of the system of care is the Navigation Center, which we're all here for today. The Oregon Business Association here has been phenomenal. Dan and your team has been phenomenal. That will provide additional resources. So we're building out the infrastructure necessary to get ahead of this problem. I know that tax check is not always fun to write, and we have a lot of taxes in Oregon, but at least you can be reassured in Clackamas County that money's not being lit on fire. In Clackamas County, that money is going to the resources that you expect as business leaders and owners and taxpayers in Clackamas County. We are putting that money to good use and making it work. And there's some additional evidence to that. In 2023, we just talked about that. In 2023, Clackamas County granted the coalition that we're all here to support today $10 million as part of our building out our overall system. And in support for that Caring Place, a homeless service resource center. The facility, as you know, will help navigate the community programs, co-locate nonprofits and service providers like LoveOne and Father's Heart, and help provide part of our safety net to that community. It will be located in Oregon City, and it will expand the overall services that individuals need. The drawings are inspiring. It is critical to the overall system we're building, and will supplement what already has been done. And the Board of County Commissioners is very proud to make it a priority within what we're building in Clackamas County. Now, I've been co-chairing with Lynn Peterson of Metro, the SHS task force on trying to address the needs and some of the major concerns we've had with SHS. Now, that's the income tax on high income earners that's providing wraparound services to those in this space. So we do have unprecedented resources and funds to do that work. The county, by all data, that has outperformed the rest of the region is Clackamas County in dealing with this issue. I believe we're close to functional zero. We just had major polling data for the region that came out of Metro shared with us yesterday. I believe it was on Oregon Live. In that polling data, there is a lot of lack of trust from the public and the business community when it comes to Metro, Multnomah County, and even Washington County. There's some effort and concern about the SHS tax sunsetting and us losing the resources. And the voters, rightly so, don't have a lot of trust with the electeds because they haven't seen the evidence with their own eyes that we're making a difference. The one exception in the region is Clackamas County. Everyone else is polling in the 20s and the 30s and the 40s. Approval rate for how local government is working in the region on this specific issue is 62% in Clackamas County. And it's not, nobody's close to us. We're in rooms we're not normally in to negotiate and have conversation about how to address this topic because we're credible, because we've governed right, because we're the local government closest to you, that's impacting this the way that you expect and the way you want your tax dollars spent. And we believe in the long run that it is moral and right to get people the access to the care that they deserve and need. And it is just and good to make sure they can recover and not be trapped in a state of perpetual addiction and behavioral health needs. And we believe in investing in that in Clackamas County in a way that we've never seen the state do or any other piece of or any other jurisdiction in the region. It has set us apart, and I believe the voters are seeing it, and I'm proud of that work. And so I know I'm only given 10 minutes, and I am known to also be long-winded, so I will try to give some time back. But I wanted to encourage you and show you some of the good work that we're doing in Clackamas County. The caring place is vital to that. We must support it. And we are building out the infrastructure in a way that's the Clackamas County way, that sets itself apart, and that is being noticed all the way from regional entities to the governor's office and to our local partners. And thank you for being part of that work. And we can't do it without all hands on deck. We are all stakeholders in this. I appreciate your time. Thank you.
Wow. Things are happening in Clackamas County, and I want to give a shout out to Ben and all the county commissioners, county chair. That's a business approach to this issue. I mean, they're really taking a great approach to a recovery-oriented system of care, and we at the Caring Place are really proud to be a part of it. Let me grab my notes here. So let's move on to the Caring Place, now the phase 2 of today's topics. And some of you are new to this hearing about this, and some of you have heard it several times. So I'm going to just talk a little bit about the Homeless Solution Coalition and, whoops, let me go backwards. And our mission. Our mission is to inspire, motivate, and empower the community to develop and implement solutions to homelessness in Clackamas County. We were established, our first meeting was back in 2016, and our goal is to have the Caring Place open its doors in 2026. So it's not an overnight process, but it's been one really great journey. So the Caring Place project includes a 35,000 square foot facility. You can see it on those boards, and we'll show you pictures here in a second. And the estimated cost of that is $28 million, and thanks to generous grant, thank you Clackamas County, it really kick-started our efforts with a $10 million grant. The state of Oregon has given us $2 million, and HSCCC is on its way to fulfilling that vision and bringing it into reality. This project, though, is more than a building project. This project is a commitment by our community to really address the most pressing challenges related to homelessness that we see. So you can't do this type of a project alone, and in just a minute you're going to meet these partners, and Commissioner West talked about many of them. But the Father's Heart, LoveOne, Oregon City Community Court, and the Clackamas County Coordinated Housing Access folks, and then our group, and then our healthcare providers. Why this particular group of individuals? Why that? It's because together you work better. As a business guy, and you've heard me say this many times, I like efficiency and effectiveness, and you can't do that when you're separated. And we found out through trial and error and in talking to our service providers and doing different projects between the first time we started and now, that it really worked to have that cooperation between the partners, and the effectiveness goes up. And you're going to meet many of them in just a minute. So let's talk a little bit about the Caring Place. This is a rendering. Our executive director just signed the application to submit our building permits for plan check review today. I think we signed it today. This building has grown. It's 3 stories. I mentioned before, about 36,000 square feet. The main floor of the building in the corner, the location is 15th and Main here in Oregon City. And we have Subaru just to the south, roofing distributor just to the north. We wanted to fit in. We wanted to make sure that we had something that fit within the community while we serve those in need. So part of, and Ben mentioned this, part of the recovery-oriented system of care is workforce training. Now, it's down that continuum, but one of the reasons we wanted this coffee shop on the corner was to interface with the business community in Oregon City and also give workforce training and workforce opportunities for those in that recovery process. The rest of the main floor is a pharmacy, a community room that'll be used by the community, but also double as our community court. We'll talk about that in a minute. And then the other back side of the building down to the 15th Street side is where the access point to the Father's Heart and LoveOne will be. And they're expanding. Right now, they're in 5,000 square feet in their current location. And for those of you that have been in there and worked and watched them work, it is crowded. And you cannot have adequate service delivery. This expands their footprint to 15,000 square feet. Second floor of the building is designed to be a medical and behavioral health floor. With that integration of services with the day shelter, it will be a game changer in recovery process. And then the top floor will be smaller offices where they'll have the Clackamas County Coordinated Housing Access will occupy, as well as HSCCC and other nonprofits in our community. This is a peek inside the building. This is coming into the lobby, and there's a lot to this that at first glance you might not see, but everything from the wood on the ceiling to the colors on the wall is what's called a trauma-informed design. You do it for specific reasons to have less calming or a calming so you have less anxiety in a space. The back portion of the lobby is where we're going to honor and recognize those that support the projects through donations. And there's an actual reason why, if you look closely, there's some live plants up above, and the various boards on that wall of various sizes will depict the various sizes of donations that people make. On those boards are images of flora and fauna from this area. The reason we did that is when we did a deep dive in the very beginning of this project, one of the things that came out of it was many of the clients at the Father's Heart would recognize and thank their service providers by picking them flowers and bringing them and thanking them. So we carried that through to, it'll be our way of thanking those that support our project. And I'm going to ask our rock star, Brandy Johnson, to come up and give us a peek inside and tell us what they do inside the building. And this is a little design.
Thanks, Dan. Do you have the pictures here? Then I don't have to stare up there. Okay. Yeah. So as Dan mentioned, currently our space is pretty small for the number of folks that we're serving. A regular day for us is about 125 people coming through our door for services. Add 10 staff or so, add 4 or 5 high school interns, add the 45 plus volunteers, community members who come through every week to make sure the laundry gets done and things get cleaned. And our space is cramped. So the fact that we will have enough space to have tables where wheelchairs will fit and folks can have space, because not everyone wants to have 25 people crammed around a tiny little table. So just the fact that you can pull your chair out and push it back in, it's really nice. So this will allow us to do that. The other thing, I'm jumping a little ahead, but I'll save time on the back end. A kitchen. So we're really creative with hot plates and with crock pots. But that is our only way to make food. And we provide 3 meals a day. Breakfast, hot lunch, and then a meal to go at the end of the day so folks have something to eat for a late snack or dinner. We do that very creatively. A lot of times that looks like folks bringing meals in, but just as often it's us utilizing the many donations that we have to come up with a nutritious meal that is also hot and will stick with folks. So the idea of having a dishwasher and a sink that fits all the dishes, they're almost crying up there in our current space thinking about it. We're like, it's happening, it's gonna happen. So that's part of it. Another piece is that took into account the fight or flight mode that folks are in when they come into the building. And for many folks, leaving their pets outside, their belongings outside, their bikes unattended to is the reality is it's going to get taken if somebody's not there to watch it. And so we built in space for bike storage, for pets to be in a safe space, and for their belongings to be stored safely. I think we're ready for the next one. Is it outside?
Yep.
Okay. Like Dan mentioned, the trauma-informed design, it's a wide open space, so folks aren't feeling claustrophobic. There's space to spread out, to sit, but also privacy. Just as much as us being located in a residential neighborhood right now is not ideal for anyone, for our neighbors, for us, it's also really important to provide that space, and people have intrinsic dignity, right? We're not giving dignity, but we're providing that respect and autonomy and also privacy. If they want to sit outside and enjoy the sunshine and not have people watching them, that also is really important to the healing process. And there's a lot of greenery that is planned, outdoor seating, and just space to be outside when it's nice, when it's not raining, so 3 months out of the year.
Okay, good. And we'll hear a little more from Brandy in our question and answer time. Thank you, Brandy. So I'll just add a couple things. If you go back, there's rooms over on this side of the building, on the right side you're looking at, for case management and private conversations. And this is a point where a lot of times I'll talk about, there's two areas of clients in this, or two areas of service in this that I see. One is we're building something, a facility that will really help and serve those on their path of recovery. But this facility is also going to provide a better place for working conditions for the people that are there on our behalf. They're on that front line every single day for us. And the conditions they're working under today, quite frankly, are horrid. And this facility will give them the space that they need to do their work in an adequate manner. So, and then the rear part of the building, the railroad tracks are on the very back. It's fenced, secured. The very far side is where bikes and stories that Brandy mentioned, and there's access control gates that allow people in. So we've thought a lot about the safety and the security of the facility in relationship to the neighborhood and the community, and it's gone into the design effort. Really quick, because we're going to get to some question and answer, you can see on the first far right slide the area for the Father's Heart and the cafe and pharmacy. The lobby was the area I showed you, and the community room in the back. The area over here, if my pointer works, is the loading dock and the area for supplies to be delivered. Second floor is the medical behavioral health clinic space, and third floor is a room for the coordinated housing access and the nonprofit offices. So a lot has gone into the design, and it's a really important piece, as been alluded to, into the whole recovery-oriented system of care that's being built by Clackamas County. Our timeline on our project, we started in 23 under serious building design elements. In 24, we just right in the middle of 25, we're on track to turn that in. There's been a little bit, if you look down below, there's been a little bit of work done in terms of the past is where the project was, Miles Fiberglass, and the present, it's been cleared and ready for construction, and then our future is the carrying place and occupancy in 26. So this is not done in a vacuum. We've been mentioned several times about the grants and the money that we've been received by the county and the state. And currently we have a number of foundations that we're reaching out to for funding, and then also individuals to support us. So the business community and individuals are critical. We can't do this alone, folks. None of us can do it. It doesn't fall on the shoulders of any one state government, any one individual, any one business. It really takes a community to raise this up. We are 12 to almost 13 million in our fundraising effort of 23, so we're just about halfway towards that goal to bring that vision to reality. So some ways that you can engage with us is invite HSCC to present to a community group. volunteer. As you can see, there's a number of agencies that can be volunteered at. They'll be at the table in just a minute. And make a donation. There's information on your tables about the caring place and about our support that's needed. You can join our newsletter, visit our website, and attend the Night of Caring. The Night of Caring is coming up right here in October. On October 10th at the Abernathy Center, there'll be a gala and a big night of caring that will take place. So if you're interested in that, you can scan that QR code or go to our website. We have information there. And just when you see the need, pitch in. Let's all do something to make it better. So let me invite our panel up and get into this meat of some of these questions, and we'll keep moving forward. And they're going to introduce themselves when they get up here to speed it along. And is there questions? I know there may be questions that the public wants to ask here today. Fill out those blue cards. We've got some I'm going to start with while you do that. Out of here. I'm sorry? Yeah, I will. Okay. Let me bring this up. Okay. So, before we open it up to the audience, and we'd like you to fill out these blue cards. If you have any questions, put those down. Okay, thank you, Sherry. We've talked a lot today about better work together, but for the sake of learning for all of us, help us understand what that means from a client or a staff perspective, or both. Since this is the opening question for each of you, please introduce yourself and tell us what that really means. Better work together. John?
Hi, I'm John Duke. I'm the Executive Director of the Homeless Solutions Coalition, Clackamas County. And my background is I ran a homeless clinic for homeless youth outside in for 20 years, and then I was the primary care officer at Cascadia Behavioral Health, integrating primary care, medical care, and mental health services. So when I came here, I think the thing that excited me and brought me here was the idea of the integration of all the services: homeless services, health services, legal services, and community support. That was a rare thing to see happen in one place, and I was really excited to be part of it.
Andrew.
Hi, everyone. My name is Andrew Suchaki. I'm the physician. I'm the medical director for the Clackamas County Health Centers. I am not your public health officer. That is Sarah Present. So if you have issues with drinking water and communicable disease, talk to her. If you need someone to treat it, you talk to me. She's actually one of my best friends, but that's the difference between Dr. Present and myself. I'm a family physician, and I also am an addictions boarded physician as well. I've been here about 12 years. We have built our health centers into also, in particular, focusing on substance use disorder, and I like to gently bring up the recovery system-oriented of the RSOC that Commissioner West has led us through. The health centers has been doing that since 2015, and we're so glad the rest of the county's coming along. We're very proud of that. I'll stop tooting our horn because we, in primary care, we are humble and we are not your fancy specialists. We do everything, we plug the gaps, and that's what we get to. What this means is collaboration, is plugging in those gaps. You want to build that culture of collaboration. You want things to be co-located and to be effortless, and you want to just build. And then if you're in the same building doing the work together, that's really what it comes down to. But really that means meeting regularly and collaborating.
Hi everyone, I'm Vahid Brown. I'm the Deputy Director of Housing and Community Development, a division of Health, Housing, and Human Services at Clackamas County. It's a pleasure to be with you here with you today. Working better together, I think I'll take a phrase from Commissioner West's presentation with respect to the recovery-oriented system of care. You saw on his first slide, person-centered care. And there's a lot of buzzwords in the work that we do, and that's probably something you've heard, maybe person-centered care. But working together is what it means to do person-centered care. People are complicated, they're complex. They don't show up in our communities with only one need, or as consumers of only one thing, or they're multifaceted individuals. Someone experiencing homelessness is not just someone who is missing a home, but that's how we kind of reduce that characteristic to homelessness. They have all kinds of needs. And so if we're going to be responsive to those needs in the way that we should, we have to work together. We have to have all of the cooks in the kitchen, and that's what it means to be person-centered.
Good afternoon. I am Amy Lindgren. I am the municipal court judge here for the City of Oregon City. I think first I wanted to start off by explaining the difference between municipal court and circuit court, because there was a major difference. Circuit court has the new building over by Red Soils, and they handle the felony, misdemeanor cases, civil cases. Municipal court is different. We have the new building in the police department, and we handle all of the code enforcement cases and the misdemeanor cases that happen within the city limits. Our city houses the jail. And so as you can imagine, people get out of the jail, and when they don't have access to services, oftentimes they commit criminal trespasses, public order offenses, and so we get those cases. And what happens is they get a date to appear in 30 days, and if they don't know where they're going to spend the night or get their next meal, the chance of them coming to court in 30 days is virtually zero. We have, over the last few years, really worked or trying to work with LoveOne and Father's Heart as much as we can, and they have just been saviors for us in helping people come to court, reminding them of their court appearances. There is a vacuum right now with the traditional court system. We cannot get people the services because we don't have access and we don't have those connections. And so being able to have those connections with the social services will really, really help serve the community who are oftentimes victims of the crimes, and also the individuals who are suffering from the instability. With the Caring Place, we are really excited because the county gave us funding to start this community court, which takes it out of the traditional system and helps connect people to the services they need. So we can work better with the agencies. Our community court will be held within the Caring Place once it's built, and we will have a manager of the program that will be working with LoveOne, with Father's Heart, and will be able to just walk out the door of their office and be able to connect to all of that. So it is really, really important for us to serve the people and the community to work better together. Thank you.
Can I just expand on one thing that Amy said? If you imagine, like, and Commissioner West talked about, there's different entry points, right? One of the entry points and touch points is that coming out of the court system, or going to a community court and then going and get the services you need that's been prescribed basically to you from that community court. And she just talked about how LoveOne and Father's Heart has been really helping that. Okay, multiply that by just being in the same building. Like, just multiply that in your mind about being right next door to them. And not only that next door that brings them to the community court or helps them get there, but now the services that they actually need to get from the court's directive are there also. It's a game changer. This one piece to get this community court with the day shelter, with the service providers, is a crux on recovery. It's a really beginning point of that system of recovery. So go ahead, Tony.
It really is a game changer. I've been in the criminal justice system for 20 years, primarily as a prosecutor and as a judge now. And we can say to people till we're blue in the face, go get a substance abuse evaluation, go to mental health evaluation, and send them on their way. And they walk out and they don't know where to go. They have no idea how to do that. And so the fact that they can access those services in the building, walk out of court, and have it right there in the same building is huge.
I hate to freestyle, but you get a medical degree, you're running late, talk a lot, et cetera. It's sort of my MO. What the judge is talking about here on the patient side, so we take care of a lot of patients that come out of the jail. I cannot tell you how many times their substance use disorder treatment is interrupted by outstanding warrants and other legal issues from across the state. And what happens to patients? I mean, I have patients who have HIV who basically go into clinical AIDS because the transitions of care are so terrible between our court systems. It's not an indictment of our court system, it's the nature of the beast. So if we can reduce the amount of warrants that are active for patients that we see, it stops disrupting their substance use disorder and their recovery. We see it every single day.
Good stuff.
Oh, good afternoon. Tony Conkle, City Manager for the City of Oregon City. So when I think about how do we this better work together, I think some of you have probably heard me say before, right? The criminal justice system isn't the method, the treatment to deal with chronic homelessness, mental health, substance abuse issues. It's a failure, it doesn't work. So it's really been how do we work together with the resources that we have, especially as those impacts have come down to the local level and there are expectations of the local to take on more of these responsibilities, both from how we address it, but also for our businesses, community members, and residents who are feeling the impacts of this as well, right? Our commissioners receive concerns all the time. Right? And there's an expectation to respond in some way. So really it's how do we approach it from the municipal side representing 40,000 people in our community. And when I think about it, and Dan talked a little bit about this, how can we be more efficient with the taxpayer dollars that we have? When I've done these presentations, I've said, give me a better response other than I don't want it here, because that's not an option, right? With the way the state laws are written and the impacts on our community members, that's not a legitimate response to this situation. And the other part is that the money being collected for SHS, we're going to go after every dime of it that we can because they're not going to give it back. It's not coming back to the taxpayers. It's going to be spent elsewhere in the region and in our community. So we might as well try to get as much funding as we can to address the situation that we see here on a daily basis with Parks Department, Police Department, Library, daily occurrences that happen. Being responsive. Getting back to showing that we are making those improvements and being responsive to not only our community members, but the folks experiencing, whether it's homelessness, mental health issues, substance abuse issues that are here in our community. Being effective at how we do this. I fully believe that bringing all these resources together in one place is going to be way more effective and way more efficient than how we're doing it right now. And I've said this before. If you come in to court and judge says you need to do A, B, and C, go up, get a social security, a driver's license, head over to mental health, get signed up for this. Your shopping cart's out front, you got to get up the hill. I'm not sure I could do it and be successful, right? So bringing all these resources together is something that we've seen will be much more effective and responsive to address this situation. And the last part is accountability, right? Accountability to the taxpayer, accountability to our community members, whether they're homeless or victims of crimes, right? This is about that Oregon City does have a minimum, a start of accountability. And by creating the community court, we get out of the justice system where we get over and over, fail to appear, issue a warrant, fail to appear, issue a warrant, issue a fine that can't be paid, into a system where now we're investing in case manager, a manager of the court, a system that focuses on what can stop that cycle of recidivism and lead to improvements with the homeless community member or about to be homeless or the substance abuse issue that falls under the radar because it is a local misdemeanor. So like I said, it's accountability to our community members as well that we are here to help and we are investing significant amount of time and resources into these, but there is that expectation that there will be accountability for what happens in our community to our community members.
Well, that's hard to follow. Brandy Johnson, Executive Director of both the Father's Heart and LoveOne, and a resident of Oregon City for the last 25 years. So I am earnest when I say I care as much about the folks that we're serving through our organizations as I do about my house neighbors, and realize the impact that goes both directions. We were asked to talk about how we do this better work together. Vahid mentioned all the cooks in the kitchen. We literally don't have a kitchen, as I mentioned, so we're gonna have a kitchen that we can put all the cooks in, right? And right now, we have to rotate our community partners through the small space that we have. So we can have DHS on Monday, but there's no room on Tuesday because we've got wound care on Tuesday. We've got the doctor on Friday who shares part of a mobile modular building with two of our staff who are organizing, X, Y, and Z. So very cramped quarters. And so having space to work better together, all of what you've heard so far and more are how we can co-locate these services so that folks, to Judge Lindgren and Mr. Kunkel's comments, penalizing people and assessing fines and fees for people who don't have those resources makes no sense. And you know what's really hard to do when you're getting ready to get housed? Just get an approval for an apartment or a house or any sort of living when you've got open cases, warrants, or felonies on your record. And you know what happens if you fail to appear? That can end up as a felony charge. So the sooner we can do diversion work and work together collaboratively to actually solve some of these systemic problems and the chronic issues that our folks are experiencing, the far better our community will be.
Absolutely. Hi, y'all. My name is Glenn Sekonic. I'm the Deputy Director of LoveOne, and I'm also the Behavioral Health Specialist for the City of Milwaukee Police Department. And I come from lived experience. So I'm going to talk a little bit about from the client's perspective. I did work here in Clackamas County since 2019 when I helped start the Law Enforcement Assisted Diversion Program. And I've worked with a lot of these individuals. I've helped a lot of people move through the stages of change. I got my degree here in the Portland area. I have a master's in addiction counseling and a master's in social work. So I understand both mental health and addiction, and I come from addiction. So our goal too is always to catch somebody in the stages of the change that they're in, whether that's mental health, addiction, houselessness, anything. I use the stages. And when we don't have something readily available and somebody walks in and says, I need to see a doctor. Oh, well, go up to the top of the hill. I just came from the top of the hill, and I've been walking around for the last 10 days, and my feet are the size of watermelons. Having a medical center there is a game changer. Somebody walks in and says, they just overdosed last night. I'm ready. I don't want to die. Oh, well, let's get on the phone and see who has something available. Having Suboxone available on site, having them be able to see a mental health and addiction professional is going to be a game changer. And that's part of the system of care. That's that first step. Our outreach workers, they're assessing people's stages, where they're at, where they want to be, what they want to do. But people are walking in crisis. Having somebody there to manage that, having a space that is big enough to have maybe a little bit of confidentiality and have some private conversations, and for the staff to feel like let's go in this room and have a conversation. There's no rooms to have conversations at the Father's Heart. So people are talking about whatever they want to talk about. They're not trying to move along in the process because their friends are right next door to them. Having some private conversations is going to be key.
Okay. Thank you all for that. And it gives you a real flavor of why and what that looks like to work together. Let's try to be then maybe a little more specific in the types of services that the community can expect at the caring place. And I was going to turn to you, Amy, if you want to expound on the type of service or the type of programs that you suggest people would have to go through to get the help they need.
What we'd like to do is have people seen as soon as possible from the date that they allegedly commit a crime. And so we're going to have the court hearings on Mondays, which is intended to be from the weekend, and have a outreach specialist from LoveOne. We've gotten funding for 2 that are that are specific to be working with our community court. And so we would see people right away. And the goal is to have diversions so that somebody would plead guilty to the offense, but then they're on like a pre-conviction probation. And the person would basically work with the outreach specialist to determine what their needs are. And so if they need a mental health assessment and just to have a doctor's appointment, then we can connect them with that. If they need to get a social security card, a driver's license, that outreach specialist would connect them to that. So it's really what the person needs in order to build their life back that we will put as part of the agreement and be working with people to achieve that. Also, it takes it out of being at the caring place, makes the proceeding a lot less scary for people. I think when Brandy mentioned the anxiety going into LoveOne and Father's Heart, imagine the anxiety going into the courtroom with me standing there, sitting way high with the black robe. I'm really short, but I'm actually sit really high. It's very, very anxiety provoking. And so being in the caring place in the community room without my robe on and the attorneys there just wearing normal clothes makes it a lot less scary. And so we can hopefully have them engaging in these services with the hope that they will be able to successfully complete the diversion program and have the case dismissed. And so that's kind of the key for them is that it gets dismissed. There may be times when it's a condition of probation versus a diversion, but in the end, we can always reduce things.
Okay, perfect. And we have seen this work. It's going to be new at the municipal level, but pre-COVID, we were doing this exact service through the county's court. And we had all this, we tested this model. We had a number of service providers, ID specialists, housing specialists. We had TriMet there for bus passes, all in the little building next to the courthouse. And the community court, or the county's community court, was in that building. And we watched this work where someone would get basically a prescription for success, is what I call it. And they would walk out that building, the door of that community room, and here in these small little cubbies were not all, but many of the people that they needed to see. And then you go back after 2-3 weeks, and you watch that person come in, and for the first time in a long, long time, they have been successful at achieving something that was put forth to them. And when they get that, you've succeeded. I mean, their family's there. It's like a graduation ceremony.
It is.
I mean, have you witnessed some of
yeah,
that?
and we have certificates, they get prizes, and it's really a lot of positive reinforcement. And a lot of counties have community court programs, but at the municipal level, we don't have we've never had the funding for it.
Yeah.
And so we have been unable to do it until now. And so that's what's great about having this for Oregon City, particularly because we house the jail and we really see a lot of these offenses.
Yeah.
We can't access the county community court. Now we're going to have our own.
And I want to applaud the county. They got the supportive housing service money. You talk about effective use of the money. They got the money. What did they do? They put a $5 million grant in total out to all the cities in Clackamas County. So they shared the love. They shared it down. And they challenged each city to come up with different ideas on how to use that money. And the idea of a municipal court was what Oregon City came up with. Other communities in our rural neighborhoods are doing other things, but they brought that money downward to help the community. So kudos. So, okay.
I want to echo that. I really can't state our appreciation enough for this opportunity. I work in a lot of municipal courts, and we could not have done this without the county commissioners approving it. So thank you.
And I'm interested in watching the success of that and collecting that data and having that inspire other communities to do the same thing. So, okay, let's go on. We've got a few more questions here. So, Vahid, do you want to share a little bit about what services the county would bringing in and maybe how that ties in with other services you're providing?
Sure, thanks, Dan. And one note on the city-led initiatives grant kind of opportunity that we had for all the cities.
Okay, I'll speed
It was $5 million of SHS for our urban growth boundary cities, but more than $2 million of other resources, including county general fund, that was dedicated to those cities outside of the urban growth boundary that were not eligible recipients of SHS funding. So it was over $7 million in total that was awarded to cities when the county assessed. We basically asked the cities, we trust you as the local arbiter of the needs in your community, and we want you to tell us what you need. And that's another part of working better together, is we trust that our various experts where they live know best the work that they do, and it's not our job to tell them what it is. It's our job to set the table, invite them to sit down and have the conversation. Yeah. That's a lot of what we'll be doing in the caring place. I mean, I think about the county's role, the role of my department in this system of care is a lot of it is coordination and convening. And we operate a coordinated housing access line. You heard Commissioner West talk about it. It was a winner last year of a national award by the Association of Oregon Counties, or I'm sorry, the NACO, the National Association of Counties. It's the best coordinated entry system in the state. I'm not just bragging. I think that's just a fact. Just to tell you a little about what it is, I mean, it's a phone number, right? It's 503-655-8575, but it's a hotline for people to call when they're in a housing crisis of some type. But it's much more than just a phone number and a hotline. It's not 211, right? When you could call and say, where do I go for discounts on my energy bill because I'm very low income? Well, let me see, that's another phone number. You got a pen? It's not that. It's a team of trained professionals who do assessments of everyone who calls, has a problem-solving conversation, really establishes trust and safety, and then moves into a pretty lengthy conversation about all kinds of things. Remember, we talked about person-centered care and how it's not just people calling and saying, I don't have a roof over my head, I need the roof. That's not the nature of the conversation. That's part of it. But it's also much more than that. And so coordinated housing access is a team of professionals that will be able to work out of the caring place to do that work of meeting people where they are, having those problem-solving conversations, and then if they are experiencing homelessness, and let me tell you, less than half of the people that call CHA are experiencing homelessness. Let me say that again, less than half of the people that call CHA are experiencing homelessness. They're worried about losing their housing. They're worried about many other critical needs that aren't getting met in their home. And they're calling us because they trust us, because we have the connections, because we are the convener, because we can connect them to all of the various cooks in the various kitchens. And that's what we will be doing at the caring place. And there's a lot of other things I could say about services that the county will show up with, but I'm just speaking on behalf of kind of the Housing and Community Development Division. I think I'll stop there.
Okay. We've talked a little bit today about providing care and access to care. Andrew, could you start in this area and talk about the medical services that you would see as the highest priorities that should be focused on in the caring place?
Thanks so much, Dan. Yeah, so when we think about medical care, we think about how we engage with primary care ourselves. And if you think about it, you're living in your prefrontal cortex, right? We're all sitting here. Maybe one or two of us is having a bad day and we're sort of in our midbrain. That's your fight and flight. It's your sympathetic nervous system. But the rest of us are thinking, we're kind of maybe oscillating between hearing Vahid's wonderful voice. I think you should go into radio. Although radio, does that exist anymore? I don't know. And then maybe you're thinking about your vacation in a couple months, maybe a couple years from now, your retirement. Who knows? But you're drifting in and out of that cerebral cortex. And primary care is awesome when you're living in your prefrontal cortex. The clients that access Father's Heart, the prefrontal cortex is a very unknown territory. So you're thinking 2 minutes, 10 minutes, maybe 2 hours, maybe 2 days in the future. So how you engage with someone in that way, getting you in to see me, who is going to look at your cardiovascular risk reduction, that is not going to land. Your priorities are not preventing a stroke. Your priorities are the basics, the most fundamental. So when we think about that, and someone who's in that world, how do we get you from here in that little midbrain to here. So it's stabilizing things that are the most destabilizing. So that includes substance use disorder and chronic mental illness. So when we're seeing someone, so when I actually take a step back, when I was in medical school, I spent a month in the inpatient psychiatry ward. And actually it was amazing. It was at Ohio State Hospital, and we could see the football field from there. It was actually kind of fun. So it was really fun on game days with the clients there. But anyway, but when I spent time there, I started to understand public transportation a little bit more, because we do not force people to be housed. You have your own autonomy in our culture. We have decided that the social safety net is built and supported by people at this table versus something more centrally funded. So as a result, things are super chaotic and people have a ton of autonomy. So if you have autonomy and you've elected not to receive care for 1,000 reasons, again, a lot of times because you're living here, not up here, this journey you take, it's rocky. And if we can get you connected to a case manager in the caring place, build some trust, maybe have you see a mental health professional, help you sort of chip away at some of those fears you have. And then the goal, one of the tools we have in our belt, are these medications, antipsychotics, you've heard of them, that are in a monthly or even every 6 month. I kid you not, there's a shot. If you want to guess what it's called, it's half yearly. Which, I kid you not, is the name of it, every 6 months. And these shots help you regulate the brain chemistry and reduce the voices, reduce some of the internal stimuli that you'll see when on public transportation, et cetera, people yelling at the sky, maybe proselytizing downtown. When I see those patients, what I see is, wow, that person refuses antipsychotic treatment. I wonder why. I mean, that's the way I see the world, but that's what's going on. And on top of that, you throw in substance use disorder. So when we think about mental illness like psychosis or schizophrenia, that's a dopamine imbalance. Well, dopamine sounds familiar, right? Why does dopamine sound familiar? It's addiction. That's what if you drink, it's a dopamine release. You do meth, it's a dopamine cascade. You're doing fentanyl, same thing. Dopamine's everywhere. So a dopamine dysregulation in dopamine is schizophrenia, and then dopamine is released with substance use disorder. So those two are best friends. So you stabilize one, you gotta stabilize the other. But if you stabilize both, then you're in your prefrontal cortex. And then you start to engage with someone like me. And guess what? If you look from here, if you have a really good arm, you could hit about 10 community health centers. We have one up on the hill on Hilltop. We got one halfway between there called Neighborhood Health Center. We've got, if you're really good, you can hit Blackburn, Central City Concern, not too far up the road. Cascadia is up towards Milwaukee. We've got a clinic at Sunnyside. If you're really good, you can hit Sandy. So we're surrounded by safety net clinics that are built for patients like the Father's Heart sees. But when you're living in that midbrain, primary care is very difficult to engage with. The final thing, so in addition to those things, so we're talking about injectable antipsychotics, injectable buprenorphine, or Suboxone, or just Suboxone under the tongue. The other option is methadone, which connection to services there is tricky, but methadone's part of this. And so when you hear methadone, what I need all of us to do, promise me when you walk out of this room, the next time I say methadone, the following doesn't happen. You don't pucker up. You don't go, oh, methadone, oh no. Methadone's awesome, okay? It's awesome. And if you have issues with methadone, I'm gonna ask you, well, there's something else going on, it's not medical. So anyway, Dan, I know, this is the cane where Dan pulls me away. So methadone is part of the equation. The point is, final thing is wound care. In addition to all of this, we need wound care way more than a day a week.
Okay, you can keep it. These are business people. They have to go back to work. Okay.
I know. You don't want to wait in the lobby?
Okay, couple questions. I got a couple shout outs here I got to do before we stop. Okay, this is a question from the audience. I'm going to skip some of the stuff we had. Will the creation of a caring place attract more homeless people to Oregon City? Fahid, you want to try that, or Brandon? Fahid? Sure.
Yeah, this is not a new question. I've heard this question before in many different contexts.
Yeah.
So oftentimes, if you build it, they will come, is the kind of the term for this. I mean, I think part of this is that there is a lot of research on the West Coast that has shown that to not really be true, just in terms of do people experiencing homelessness go to other communities in some sort of high numbers in order to seek services? And this is, I think, a very persistent notion that people have, especially in West Coast cities. People came here to the Portland area because we're so generous. whereas in Kansas, where they came from, they're not, or something like that. The data doesn't bear that out. It doesn't bear it out. The vast majority of the people that we survey all the time, every 2 years we do a point in time count, street count. Every day we operate the Coordinated Housing Access System, CHA, so we're talking to people on the phone every day. We have outreach professionals and day centers like the Father's Heart and LoveOne who are interacting with people experiencing homelessness in our communities every day. And we also fund through things like the city-led initiatives and others, behavioral health specialists and homeless liaison officers through our police departments who are also interfacing with the community of people, including those experiencing homelessness. They're from here, folks. They're from here. And they're not just from here in the Clackamas County sense, they're from here in a very local sense. When I did a Springwater Corridor survey several years ago, and I surveyed 124 people living on the Springwater Corridor in a series of a few weeks over the summer of 2017. And when I asked folks, where were you last housed? More than 2/3 of them pointed to something that they could see. That apartment complex right over there. My grandma's house, where I grew up right over here, she died, right? So people who are extremely low income and coming from generational poverty, they lost their housing in this community, and it makes sense that they would stay where they lost their housing because that's where they know people. That's where their aunt and uncle lives. That's where there's someone they went to junior high with that will say, you know, yes, you can stay in my garage in the winter for a few weeks at a time so you don't freeze to death, right? Now, it is a legitimate concern, however, that if you put a center with lots of resources in one place, all of the different people that are trying to get those resources are going to come to that center. And a part of this for the county's vision of this is it isn't just the caring place, right? The caring place is a service-enriched resource center. That's what we call it. We fund service-enriched resource centers throughout the county, including in Estacada, Molalla, and in unincorporated Clackamas County on 82nd Avenue. So there are multiple places where folks can go in their local communities to connect with us, to say, I'm needing help of X, Y, and Z. Please, who do I talk to? Well, they're in that room or in that room, right? That's the beauty of the caring place. But it won't be that if someone learns in Sandy, or they learn on 82nd, or they learn in Canby, oh, the caring place is in Oregon City. Well, that's not the only place that those folks have to go to access service-enriched resource centers.
Okay. Yeah,
I'll be quick.
30 seconds.
The reality is the jail is here in Oregon City.
Yeah.
And so Lake Oswego, Westland, Gladstone, Molalla, they arrest people and they take them to the jail, and then they get out in Oregon City. So that is the reality. And so how do we then, when they're here, if they're not going back, help it so that they don't keep committing crimes? Also, I was the prosecutor for the city of Molalla for a number of years. And I had a number of individuals who were homeless, houseless, and had major mental health issues. They always went back to Molalla. That is their home. And so they would walk from the jail back to Molalla. And so I think, this is just my experience. I don't have any data behind it, but just in my work experience, they have that community feel to Molalla, to Canby, and they get their way. They find their way back, whether it's walking or taking a cab or an Uber and not paying the person. That happened all the time too. And so I don't see it as a huge risk. I can understand people in the community feeling that way. So I understand the feeling, but I don't think it's a risk.
It's a very legitimate question, and I get it. The thing I would add to that is there are some new services with the Caring Court, but a lot of the services that we're talking about here today are happening today. We're not waiting for this building to do those services. What's changing is better space, it's not so crowded, and better coordination. It's under one roof. So we're bringing those two things together. That's the caring place. It's already here happening, but it's not as efficient and effective as it can be. So, okay. Another question from the audience. Maybe this is to you, Tony. How is the city going to support increased police presence downtown for safety concerns? So there is an assumption that there will be some increased safety concerns, and I'll say that we're doing everything possible to eliminate that. And I know Brandy and I have had meetings with Juliana about some things that we're doing downtown in terms of cleanup crews and those kind of things. So, but the reality is there may be. So,
Yeah, so I think, we've had this question before, and I think this is part of why engaging early on in the design, how this facility is going to be run, addressing those concerns up front. But from the city's standpoint, this is part of creating the community court part of this is you need to call us, right? If it's not an emergency to dial 911, call non-emergency, right? I always get well, this was happening 3 days ago. Well, why didn't you call? Well, we didn't want to bother the police department. And it's like, literally, that's why we are here, is to address these concerns, right? We might not come down immediately. I would probably guarantee you it's probably a known community member in terms of who we're responding to, between Val and behavioral health, who's also going to have additional caseworkers helping her, our police department, who are routinely engaging with our homeless community members. It's pretty rare that we don't know someone who we're going to interact with. So, in terms of how do we, what's our response going to be? Part of it is asking our community members to utilize the resources that we've put together. Call us. We will come. We will probably know who it is. We will send Val. We will send an officer. We will get them into community court, which is why we're setting this up to hopefully get back onto some type of a treatment program or a path towards homelessness or employment or mental health or substance abuse or all the above or one of the above, right? That's the whole reason we're doing this. So, that's my response to that is we run 24/7. Every day we have officers on the street, available, responding. So part of it is, don't fall into, we didn't want to bother them, right? Literally, that is why we are here. And the only way this is going to work is if we are informed so that we can track it, we can respond, and then we can start to get them into a path, which is, like I said, the whole investment that we're making here from the city side and the community court, but then also partnering with all these great partners that we have here today.
okay, we're going to go to a rapid fire round for about a minute. Brandy, or Glenn, but Brandy, will there be, will there be operating hours? What are your operating hours?
Yes, currently our operating hours are 9 a.m. to 2 p.m. We hope to expand, and that is all based on Monday through Friday, yes.
Okay.
All based on budgets and staffing.
Okay. Is there an age requirement?
No.
Okay. And will there be room for childcare and space for school-age children to have tutoring or electronic access?
Not within the Father's Heart. We primarily serve adults, and co-locating those with our general population is not a direction we're looking to move into.
Okay. Keep the microphone. How do you help the frontline employees deal with their own trauma, especially with clients suffering serious injuries?
That's a really good one. There's a team at the county that's available to us, and even more helpful is the relationship that our staff have built with a community member who is a therapist, and she comes and meets with them as groups, individually, and she has just made herself available to us. It is a paid service, but specifically when things happen, like there were a couple of overdose deaths 2 weeks ago, and we were able to reach out to her, and she was on site right away and set up meetings and was just able to provide that support for us. So, yeah, any and all options.
Okay, one last question for you, Brandy. Is there a list of volunteer positions available?
Yes, I believe on both the LoveOne and Father's Heart websites, and we're always happy to take emails to our general email address and respond to those.
Okay, John, I'm going to give you 30 seconds. It's hard to access, because I know Andrew would take 3 minutes, so it's hard to access mental health providers. There seems to be no openings. How will you address this?
Well, that's the reason that we are trying to get a federally qualified health center in the facility. Federally qualified health centers provide mental health care and substance abuse treatment, same-day access as part of the care that they provide. So having that located with Father's Heart and LoveOne will provide that. So go ahead.
This will be really quick. We do have capacity. When you say there's no access, there's no way to access mental health, there's plenty of mental health access in this community, and so I challenge that.
Yep, that's fair. The last one, there was workforce training was mentioned. Please expand. We've talked just preliminarily with community college about workforce training. There is actually a group in Oregon City that does specific workforce training. They'll help us fill those and train those individuals like to be in our coffee shop. So we're serious about helping someone recover all the way to workforce training. That's it. I think we got through all the questions even. That's amazing. I want to give a couple shout outs. One, I can't go without mentioning our builder group here from Hoffman and Precision is our general contractor that won the bid. Thank you guys for being here. You did awesome so far. Tearing the building down. Look forward to building one up. Okay, thanks for being here. And I just want to thank everybody that's here for coming. We've been here a few years. We're trying to keep it informed and keep the public informed of what we're doing. Go to our website if you want to volunteer. You can also call or access us that way. And thanks for OCBA for putting on forums like this that help all of us get educated on community issues. You're up. And I can't say one more thing. Shout out for October 10th. Come to our big gala. There you go.
Yes. Put that on your calendar. October 10th here at the Abernathy Center. Well, I can't believe you got through all those questions. I was watching the clock and I go, I'm enjoying the panel presentation so much because it's so authentic, so genuine, so full of passion and information that you're sharing with us. But I also know we got to get to those audience questions too. So thank you, Dan. And I want to personally, on behalf of the Oregon City Business Alliance, thank each and every one of you for coming today. I know this means a lot to you to have this facility, and your generous desire to make an impact in our community is truly felt by the way you shared with all of our attendees today. So could we give them another hand? So just a little bit about what we're planning next month, but before I do that, I want to do a shout out to the Abernathy Center. What a delicious meal. So could you give them a hand? Everything was fantastic. I don't think we ever disappoint with the bountiful cuisine we get here. We've got strawberry shortcake today on top of the delicious meal. How do you beat that? So next month, we're going to talk about downtown Oregon City. As you know, we have all 5 county commissioners here, and they're in the process of negotiating with an individual on our Business Alliance board for a revitalization plan of the existing county courthouse. We're not sure exactly what the final product will look like, but we do have a pretty good idea of what this particular firm's vision is for that space. So they'll be giving a PowerPoint presentation on how they'd like to move forward, and they have a specific timeline as to when they'd actually like to start doing demolition of that building. Then Juliana with the Downtown Oregon City Association is going to share with us a little bit about the First City celebration that'll be happening later on next month, as well as a lot of other things that are happening downtown. So I think you'd like to hear all of that. There's also some things taking place on the upper level by the elevator. So we'll have the owner of that building share part of his vision, but it's going to go through a real transformation downtown Oregon City, having the courthouse moved. But sometimes transformations are positive. Sometimes having a change gets people to refocus on new ideas, new concepts, new ways of utilizing your space. And that's what we're hoping your questions next month gives those folks direction on what you'd like to see occur in downtown Oregon City. So with that being said, we got a few more days of sunshine. The rain is coming this weekend, but we need some rain. So go out and enjoy it today, and we'll see you next month. Thank you.